Hi there, my name's Anthony Hurley and I'm going to be showing how to do NG tube insertion. So here, as you can see, I've gathered all my supplies and I'll kind of explain what they are as I'm going through it. So I gathered all my supplies and now I'm going to the patient's room. So first thing I would do is I would knock, come in, wash my hands, and then I would acknowledge the patient, but the patient may not be able to speak, so I will establish a nonverbal form of communication with them. So thumbs up sound good for yes, and thumbs down sound good for no. Thumbs up, and then after I've done that, I'll pull the privacy curtain and so then I would talk to my patient and say, "Hi Heinz, my name's Anthony. I'm going to be your nurse today. Today I'm going to be inserting a nasogastric tube for you. Your doctor has prescribed this for you to help relieve some of the stomach problems you've been having. So before I went into the room, I would have verified that there was an order for this in Heinz's chart. And now I'll ask Heinz, can you verify your name and date of birth for me? Is your name Heinz Ward and your birthday March 8th, 1976? And he gives me thumbs up, okay. And do you have any allergies? Thumbs down, no. Okay. And I'm gonna tell him that it would take 15 minutes to do this skill. So after I've washed my hands and provided privacy, I would put gloves on. And this is a non-sterile procedure, so there's no sterile field to worry about breaking. And these gloves don't have to be sterile. So now that the gloves are on, then I can get Heinz all set up and ready to go. So I'd come to Heinz's bed and I would raise it up to a comfortable working height, and I'd set him up into high fowlers, and I would make sure I had suction ready and on if I were to ever need it. And then the next thing I would do is I would ask Heinz about any nose trauma or nose surgery he's had in the past, because I'm going to be sticking this tube up Heinz's nose, so it'd be important for me to know if he has any sort of history of that. So now that I've asked him that and he says no, I'm gonna look with the flashlight up Heinz's nose, up his nostrils, and see if there's one side is bigger than the other, if there's any obstructions, to help me pick what nose would be better for me to go up in. And then I'm going to occlude one of his noses and have him sniff, and occlude the other nostril and have him sniff, and that'll also help me to better determine which nostril will be appropriate for me to choose. Next, I'm going to have Heinz open his mouth, and I'm going to come in from the side, kind of at an angle like this, and have him open his tongue, and then we go back to the uvula and kind of depress his tongue and at the uvula area with this tongue blade. And I'm assessing for a gag reflex, so he has a gag reflex. Now I'm going to measure. This is an NG tube, so I would unpack it and I would measure the correct length. So I'm going to go from the nose to the earlobe, and then from the earlobe to the xiphoid process. Okay, and then once I get to there, I would mark this spot here with tape. Okay, so marking this spot with tape. I mean, if I had better tape, I would do it, but I think this tape will stick to this spot. So marking it with tape, and now what I'm gonna do is I'm gonna get all set up here. So I've got this here for Heinz's chest. So I cover Heinz's chest like this, right under the neck of him, and it didn't have to be sterile setup. And then what I'm gonna do next is I'm gonna hand him this cup of water with a straw and an emesis basin. So hand it to Heinz. I'm gonna, here you go, Heinz. And then this is in case he throws up during this. And then I'm gonna tell him when to start sipping. Once once I tell him to. So this is on Heinz's chest, and now I'm gonna take this lubrication, and all this stuff I would be set up like on the side table, but since Heinz doesn't have a bed in this scenario, I won't be able to. So I'm lubricating with water-based lubricant his NG tube, so that's all lubricated. And now what I'm going to do is I'm going to go to the side of Heinz's nose that I've selected, and I'm going to tell him that I'm going to be now inserting the NG tube. So I'm going to insert slowly, more at an angle towards the septum, and as I'm inserting, I'm going to instruct Heinz to bring it, like tilt his chin to his chest, like that's kind of the angle that you want to have him be at. And so once I'm inserting, and then once I get to about the level of his gag reflex, I'm gonna open his mouth and like look at the back of his throat to make sure it's not coiling in there and that it's going in correctly. And then once it gets to this point, I'm gonna tell Heinz to, like I looked, it's good. Heinz already has this in his hand, but I'm gonna say, okay, Heinz, like start drinking water. So he's drinking the water, and then as he's drinking the water, I'm gonna tell him to keep drinking the water until I'm done inserting. So he's drinking, I'm inserting, and then once I get to that spot where I had the tape measured, so it'll be in his nose. Once I get to the spot where the tape was measured, that I measured earlier, you know, to the xiphoid process and all that. Once I get to that spot, then he can stop drinking because it's in as far as it needs to go. So then what I'm gonna do is, this would be in his nose now, so he'd have like the cord sticking out of his nose. And what I'm gonna do next is I'm gonna take the tape that I pre-ripped, or I could use there's like a bandage kind of looking thing that's for it. But I take the tape that I pre-ripped and I tape across his nose, and then I'd wrap around, over, and across the bridge, and then around, over, and across the bridge of his nose, and you know, make sure it's not in his eyes or anything. So I'm securing it with tape, and then you can do 2 more tapes for good measure. So now Heinz is all taped up and ready to go. And the next thing that I would do is there would have been this tube that was attached to the bottom of Heinz's NG tube. And so what I do is I would withdraw the stomach contents, you know, like, so I pull back, withdraw stomach contents, and then I would put it in just like a cup that holds the stomach contents, and then I would take a pH strip, and I would take the pH strip and, you know, put it in the stomach contents, and then I would have a little chart here that like I would read, and it would tell me the acidity of the secretions I just withdrew from Heinz. And so I would want the number, the pH, to be between 0 and 4, and it is, so that helps me to verify that it's in his stomach. And the NG tube is in his stomach, that's what that verifies for me. And then what I gotta do next, since I just pulled all that stuff out of the tube, is I would have to grab like, this would be a bigger syringe, but I would draw up a syringe full, and I would go back to Heinz's tube, which I had clamped off because things would be leaking out if I hadn't clamped it off. Go to Heinz's tube, and I inject slowly. Oop, don't want to get that wet. So this is injected into Heinz's tube, back into his stomach to flush the NG tube. So I just flushed Heinz's NG tube, and now I would take my stethoscope and auscultate his lungs if I needed to. I would auscultate his lungs, and then it'd be time to send Heinz over to get an x-ray. But before I went to send him to get his x-ray, I would pretend this is his NG tube. I would tape his NG tube. And then I'd take a bobby pin and like clamp it to his gown, and I would make sure that it's not too tight so that he's able to turn without it pulling his nose. And then I would send him over to get a chest x-ray, because that's the number one way, that's the only way to fully verify that the tube is correctly placed. And then I would clean up all of these supplies, and I would get Heinz back into bed until it was time for his chest x-ray, or chest x-ray would be coming, but I'd be cleaning up all these supplies before I take him to chest x-ray. It kind of depends on like the situation, but get all that set up, and then, or all this put away and everything, and then I do my safety checks. So bed flat, low, locked position, bed alarm on if indicated, side rails up ×2, call light within reach, ask if he needs anything else, remove my gloves, wash my hands, pull the privacy curtain, and then I would go out and document. And that's it. Thanks.